Opioid receptors are expressed throughout the body, including high concentrations in central nervous system areas involved with the processing of nociceptive signals. Endogenous opioid peptides, such as endorphins, bind to G protein-coupled opioid receptors. Activation of these receptors, for example, presynaptically and postsynaptically, at the first central connection between the first-order nociceptors and second-order neurons that carry pain signals up the spinal cord, dampens pain transmission and reduces the perceived intensity of pain. Opioid receptors are also located peripherally in the GI tract, where their activation modulates physiologic processes from the lower esophageal sphincter to the rectum. The most clinically relevant GI effects of exogenous opioids are mediated by mu-opioid receptors in the enteric nervous system. The enteric nervous system is sometimes called the body's little brain because it contains a large number of neural networks that regulate the physiologic state of the GI tract and provide critical feedback control of gut movement, fluid exchange, and local blood flow. The enteric nervous system also regulates contractions in the circular and longitudinal muscles in the GI tract, which helps in the mixing of contents and the coordinated contractions needed to propel contents through the GI tract. The local activation of mu-opioid receptors promotes non-propulsive contractions in circular muscles, thereby increasing fluid absorption. Additionally, reduced tone in the longitudinal muscles decreases propulsive contractions, leading to increased transit time. Other relevant effects of mu-opioid agonists include increased tone in the pylorus and the ileocecal sphincter, as well as decreased secretion from the gallbladder, small intestine, and colon. Together, these opioid-induced effects contribute to the development of significant bowel dysfunction, of which constipation is the most common. Importantly, patients do not develop tolerance to treatment-related bowel dysfunction, unlike most other side effects of opioids. Constipation may cause patients to self-adjust their recommended analgesic opioid doses, reducing the chance of clinical benefit. Opioid-induced constipation can significantly reduce patients' quality of life. Moreover, opioid-induced constipation is associated with a number of medical and psychosocial complications, including hemorrhoid formation, gastroesophageal reflux, psychological disorders, and rarely even bowel obstruction or rupture. Therefore, it's critical to anticipate, identify, and manage bowel dysfunction in any patient on chronic opioid therapy. A number of non-pharmacologic and pharmacological options are currently available to us. Recent research has focused on potential role of opioid antagonists, particularly for patients who do not adequately respond to dietary changes and conventional laxatives. These agents treat the underlying cause of opioid-induced constipation by antagonizing mu-opioid receptor activity in the GI tract. Recent opioid antagonists have been designed to prevent the active drug from crossing the blood-brain barrier, thereby limiting their effects to the periphery without interfering with the centrally mediated anti-nociceptive effects of these analgesics.